So what if you're missing teeth in the front? Why would you get a dental implant over a traditional bridge?
A traditional bridge involves preparing the teeth on either side of the missing tooth. So basically what we're going to be doing is removing all the enamel off the adjacent teeth, putting on a fixed bridge that's glued onto those adjacent teeth.
Okay.
It used to be that that was our best procedure before we got into doing implants. But the problem with that technique is that we're going to destroy 2 more teeth. And ultimately, you're going to end up with 2 or 3 implants instead of just 1, because you will eventually lose those other teeth. Now, aesthetic zone implants, you asked about the front, if you're missing a tooth in the front. Aesthetic zone implants are kind of, I've become very good at them. I get a lot of referrals specifically for doing those front missing teeth because
I've had dentists on the show that say the front teeth are very tricky.
They
don't even like to touch them.
They're the most tricky of all the implants that we do. Yes, I do.
Okay.
Yeah, because the aesthetic zone implant, the issue that we have with them is that in order to make it look good, so we know we can make teeth that look white, and the porcelains have gotten very good. We know that implants work, so we know that we can put the post in and it'll fuse to the bone. But the hard part is getting the gums to drape around that tooth, and have that arched shape to make it look like a tooth. That's what gives it away. And when you smile, if your gums are all flat or they didn't look good, and they didn't wrap around that tooth properly, well then it's not going to look proper. And this is something, that's the difficult part of getting a single anterior tooth to look like a tooth.
So what about cost? Which one costs more?
The bridge is going to be the most expensive treatment. In the short term, the bridge might be a little bit less. And realistically, bridges are not inexpensive either.
Okay.
And so, but in the long term, the bridge is going to be 2 or 3 times the cost because you'll ultimately lose other teeth. You'll need root canals on those teeth. You're going to spend a lot more money maintaining that bridge and the teeth that it's attached
Whereas
to.
an implant, you just get your tooth back.
You put the tooth in. We don't touch anything adjacent to it. We're not going to harm more teeth to, to fix the one that, that you lost. And so the implant is the less expensive option in the long run. Let me show you this situation here. This young man came to see me. He was missing his front tooth, this one, the one just left of center.
Okay.
And he never had it. And this is a common thing. We see this quite a bit. There's lots of people who are just not born with those teeth. And so he came to see me. The bone there wasn't very good, so we had to reconstruct the bone first. Then we had to, we did a lot of work to get this looking like this. But the key thing here is, can you actually tell when you look at this photograph which tooth is the implant?
Yeah, you can't tell.
You can't tell. And the important...
So to other dentists, this is like bragging rights. Like this impresses other dentists.
Absolutely.
So
people look at
you
that.
Can't tell.
This is the holy grail, is trying to make something look like they never lost a tooth at all. The way the gums drape around that implant, the aesthetics of it, this is very difficult to pull off.
So if you're missing one tooth, like if somebody in your family, and they were of the age you could do it.
Yep.
If they were missing one tooth, you would never do a bridge on them?
Never.
Really? Okay. So always ask about dental implant options when it comes to this.
Most people today, we're getting to that point. Most people come in today looking for the dental implant.
So if they all knew how easy it was or how it didn't hurt as much as they think, are they just afraid of surgery? That means once the word gets out, no more bridges?
I don't think so. I think that what I'm seeing today is that people are going on the internet, they're educating themselves, and what I find is that when it does come to the aesthetic zone, that's when they start really thinking about who they're going to have do it. If it's in the back, most guys who are doing implants can handle that, and so they don't necessarily seek me out. But certainly when you're going to get into the front zone or you're going to get into things that are a little bit more complicated, that's when they start looking for people who have experience.